Hi, Mr. Broussard. My name is David Almasi. I'm with the National Center for Public Policy Research. You recently said that Medicare-For-All is a, quote, great opportunity for the industry to be able to expand the population that it's coordinating care with. No, it wouldn't. As a company investor, I find this kind of talk disturbing. And what's more, as a healthcare consumer, I find that talk kind of mortifying. Under the plans laid out by many on the left, which you all but endorsed, the very first step is to abolish private insurance. In fact, Senator Bernie Sanders recently introduced the Medicare-For-All plan in the Senate that summarily wipes out private health insurance industry. In his announcement, he even took a swipe at greedy and corrupt insurance companies like Humana. He said, together, from coast to coast, we're going to roll up our sleeves, we're going to take on the insurance companies, we're going to take on the drug companies. When people hear you say that Medicare-For-All is a great opportunity, they equate your opinion to Bernie's, and people are being duped. Polls do show that Americans want free health care, but they don't realize it's not free and it can be severely rationed. Then, not so much. What's more, your pattern of public positions on health care is greatly concerning to us. At the 2017 Humana shareholder meeting, you told my colleague that you had absolutely no plans to get involved in legislative efforts to repeal and replace Obamacare, despite rising costs, increased unpopularity, and folks losing their doctors and health plans. This is even though Humana and other large insurers played a major role in foisting Obamacare on the American people. So in order, you endorsed Obamacare, you refused to help fix it, and now you support Medicare-For-All. What happened to your fiduciary duty to your shareholders, which could be wiped out under the left's Medicare-For-All scheme, and what do you have to say to those who like their Humana plans but stand to lose them due to a federal government takeover?
Okay, let me try to address that in some ways. Medicare-For-All is a relative description. When we think about Medicare-For-All, we don't think about Medicare-For-All without an insurance program, even though there are programs out there that are being proposed that have insurance in there. What we find, there are three parts of healthcare that are important. One part is who pays for it. Second part is who helps coordinate the care, and as you can see from our organization, we do a very effective job in both increasing the health outcomes and, in addition, satisfying customers that are looking for their assistance in that. And the third is part of providing it. As you can tell from many different vantage points, including Medicare Advantage growing from a low of 10% in the late 2010 era to today being 35% of the population, that Medicare Advantage is a great program. My comments that you're referring to are really around the coordination of care. We truly believe that for a healthcare system to be effective, you need somebody to assist in the journey of helping people through the health. Paying for it is one thing. Being able to help them navigate through the healthcare system and helping them with their conditions and helping them with the complexity of the system and helping improve health outcomes and improve the satisfaction is really what we're driven towards. Medicare-For-All? Medicare-For-All could be viewed Medicare Advantage for all. Medicare-For-All could be viewed as being a Medicare fee-for-service system with an ACO component to it. So for us as an organization, we believe coordination of care is an important part of any health system going forward.
So would you put yourself in the camp of your colleague at United Health Group? David Wickman earlier this week said that Medicare-For-All, as in the Bernie Sanders idea, as in the leftist idea that I think that we can say is probably what would happen in a couple of years if there was a change of government, that his quote was it would destabilize the nation's health care, and I think more important to what you're saying to me, he also said it would seriously jeopardize relationships between people like you and people like me.
Yeah, I'm not going to comment on both on that detail and that David outlined, and I'm not going to comment on what it could mean to the industry. What I do want to comment on is that we believe that any system requires somebody to help coordinate the care, and the insurance companies today are an important part of that.
Are you saying that you want a seat at the table?
We like to limit it to one question. We've allowed you to. We'd like to have other people have an opportunity to ask questions.
Okay.
Thank you.
Well, just remember, you had a seat at the table last time. You didn't really get what you wanted, and
Thank you.
You're not going to get a seat at the table if they take over everything.
Yeah. Thank you.
Thank you.
Any other questions at this time? I see none, Bruce.
Okay, thank you.
Thank you, everyone.
Thank you, and thank you for your support.